Hello and welcome to all who have joined us for this interview, which is part of the Cambridge Judge Business School video series, CJBS Perspectives, Leadership in Unprecedented Times. We sincerely appreciate you for joining us today. By way of quick introduction, my name is Paul Tracey, and I am Professor of Innovation and Organisation, and I'm also the co-director of the Cambridge Centre for Social Innovation at the Cambridge Judge Business School. We are hugely honoured to be joined today by Professor Dame Carol Black, Expert Advisor on Health and Work to NHS England and Public Health England, Chairwoman of the British Library, and, until recently, Principal of Newnham College at Cambridge. Carol, thank you for participating in this series, and please let me extend to you Cambridge Judge Business School's thanks for your collaboration and support, for your leadership of executive education at the school, and for your help in catalysing the Women in Tech programme that CJBS has been running jointly with Newnham College and with our Women's Leadership Centre. Welcome, Carol. It's fantastic to see you. By way of introduction, perhaps you could just tell us a little bit about yourself, the beginnings of your passion for medicine and the trajectory of your career and research.
Well, Paul, my passion for medicine started while I was at Bristol University studying for a degree in history. I went there believing I would enjoy history. I'd enjoyed it at school, although I'd thought about doing biology, physics and chemistry for my A-levels, but actually I had a crush on the history master, and so I went into the History 6. When I got to Bristol, I realised I'd made a really rather awful mistake and that I needed to do a different degree. I didn't enjoy it at all. I was extremely worried because I was the first in my family to go to university. Therefore, I thought I really had to complete a degree. But increasingly, I realized I needed to do something that was much more people-orientated, in a way, hands-on people-orientated. And I got very drawn into medicine. I was sharing a room with somebody who was doing that subject, and I was surrounded by medics. I'd also the previous year taken a gap year in a way because my mother had cancer and my father was sick. I had had a lot of experience of hospitals. I don't know what combination of things brought all that together, but it became almost a burning platform for me to do medicine. I have to say it took quite a while from thinking that even in my first year of history to being able to go to medical school, and I didn't go to medical school until I was almost 26. So if you could like, I was a graduate entry. I did complete the history degree, and I did do a diploma in medical social work. I sort of put off this enormous decision to go back to have to do virtually A-level science. So that's how I got into medicine. And once I was there, I just loved it. I knew that this was absolutely the right decision. It was very tough. I felt I didn't have as good a science background as I would have had if I had done 2 years to do my A-levels. But I really went on and loved every bit of the course. I think I could have almost specialized in anything except perhaps psychiatry. But in fact, I ended up choosing rheumatology, or rather rheumatology found me. My professor of medicine, and I did several jobs for Alan Reed, said to me, you need to find a subject which isn't full at the top. If you want to do hospital medicine, you're 8 years older than everyone else. And therefore, if you want to go to the top quickly, you do not want to have lots of competition waiting for jobs. So indeed, I chose rheumatology. I wouldn't have said it was my first choice. And then my subspecialty, because I sat at the National Centre for Scleroderma, found me when I looked after a young woman of 26, admitted overnight when I was the on-call doctor with this rare disease, scleroderma. And I didn't know how to treat her, kidney failure. The next morning, Alan Reed said to me on the ward round, well, none of us know Carolyn, she'll be dead in 3 weeks. And she was. And that really did something to me. I couldn't believe there were diseases for which you could do absolutely nothing. This was one of them. So I spent, 25 plus very, very satisfying years specializing in connective tissue diseases, setting up a laboratory as well as a clinical service. Then I moved into hospital administration, becoming a medical director, and then somehow got into the Royal College of Physicians, and they elected me as president. And from then I moved on to become the National Director for Health and Work. And my interests changed very much into being really interested in the social determinants of health, particularly employment and unemployment as being a very powerful determinant of our ability to have a good life and indeed a healthy life. And then, of course, I had the opportunity, I didn't expect it when I applied, to become head of Newnham. I'm really passionately interested in women and women's development and education and progression. And so Newnham came along, which was wonderful. So they're just some of the things that have ended up with a rather varied career.
I wonder if you could tell us a little bit about the main drivers in your career.
From quite an early age, Paul, I thought there was something out there that I was missing. I can only describe it like that. I didn't know. I came from a poor family in the middle of England, and no one had even been to a grammar school in my family. But I had this idea that beyond the place I lived, beyond what I knew, there was something that I would like and that I would want to go after. I think that was quite a strong driver. I was always looking to escape, really, and to go beyond where I was. I think the other thing that has driven me in a way has been determination, because we all get lots of failures, and I've had to learn, and I think it's crucial to learn how to brush yourself down after a failure, not dwell on it too long, and go for the next thing, not be put off. I think that helps build resilience. And I think resilience is really important as you sort of drive forward. And then I think confidence has been built slowly. I wasn't confident as a young person, and it took me to get to quite an age before I really did feel quite confident in myself. And then the other driver, which I think I still have actually today, is I'm always interested in new things. I like to try new things. I like to build things. I like to make things work. And that's been wonderful, because I have taken on things I've never known whether I could make a success of them. I mean, goodness, being National Director for Health and Work is a prime example. Being head of Newnham, and now doing a drugs review for the government. These are all new, difficult and challenging and interesting things. And it's that drive to do something new and make a different contribution.
That's great. Thank you very much. Well, one of the things we wanted to talk to you about today was your interest in health and occupational health in particular that you mentioned. And in 2008, of course, you published a report which was very influential. It was called Working for a Healthier Tomorrow. And it was considered groundbreaking in many ways because it initiated a growing conversation on the importance of health, and in particular mental health in the workplace. And that was a conversation that was not really happening very openly at the time. And now, of course, here we are almost 3 months in lockdown, more in some places. And this, of course, is a really important topic that's on the agenda. So I wonder if you could say a little bit more about that report. What was the gist of the report and some of the key findings in it?
Thank you. Well, when I started the report, what I was really trying to do was look at the barriers. What were the barriers to people not being able to be in work? I wanted that work to be good work. I have no interest in people having to do really awful jobs. Were those barriers health? Were they social? Were they poverty? What was it? Was it a lack of education? What were the barriers? And who were the institutions and the people who might be also adding to those barriers? and were there things that weren't developed enough that could have supported that? So the whole idea was to identify, if you like, the barriers, and then to come up with some solutions, some policy options as to how we could make things much better. And I only had 10 recommendations in the review, because I believe you shouldn't give government lots of recommendations, because otherwise they choose the easy ones. And government did accept all of those recommendations. But I think perhaps more importantly than the actual delivery of the recommendations in some ways, was it opened up a different conversation. It opened up that conversation that people might be unable to be in the workplace because of poor leadership. If you look at that report, we started the conversation about good leaders, about capable managers, because it was very obvious as we did the report, there was a lot of mental ill health, anxiety and stress, but a lot of that was coming from poor managing of the individual. They really did not feel trusted at work. They didn't feel they had any autonomy. And the number of times I have heard people say, I can't go back to that job because of my manager. So that whole discussion, which of course now we take for granted, and we take mental ill health much more for granted. But when I first wrote about it in that report, it really was the very early beginnings of acknowledging that anxiety, stress, and depression were very powerful factors in people not only being absent from work, but being at work and not able to work to their best capacity. I don't particularly like the word presenteeism, but people use that. And so that was what we were seeing.
I think another important part of the report as well is you raised the point that occupational health applies not only to people in work, but also people out of work or people looking for work. And oftentimes they don't actually have the support that they need.
Yes, well, certainly when I did that report, I think it's a little better now. I think only about 35% of workers had access to occupational health. And of course, that occupational health was only in workplaces. It was either in the NHS organisations and paid for by the NHS, or most occupational health was in private companies. So if you were an SME or you were self-employed, you had no access to this. And I wanted to see, and I wrote very clearly in that report, a really radical change in how we valued and developed occupational health. And I wanted them to move away from their most conventional practice, which of course is essential, the things they have to do to abide by the law. But I wanted them to think about the whole person, if you like, about total worker health. I wanted them to start to be interested in mental health in the workplace. And so to expand, if you like, their service and what they could offer. Because I think it was and is a specialty that's at the interface between the employer, the employee, the employer, and government. And I'd always hoped it would have a much stronger voice in the corridors of power.
So as you say, the recommendations were accepted by the UK government. Now, since the report was published, what progress do you think has been made over those past 12 years?
There has been progress. Has there been as much as I would have liked? No. But just to give you some examples, it was obvious we shouldn't have a sit note. We really needed a note that said what you could do, not what you couldn't do. And it was a very binary note. You were either 100% fit or 100% unfit. Well, I would suggest to you, Paul, that none of us are 100% anything. And as you get older, you're certainly not 100% fit. So we did change the legislation. We did bring in a note called a fit note. The sad thing about the note is not the note itself. If it's used properly, it's very effective. But it has been extremely difficult to get our general practitioners to fill this note in. in a meaningful way, because you have to understand they feel they are the advocate for the patient in front of them, and therefore they are not likely to do things which their patient would not wish. It's putting them in an almost impossible position. And at the moment, I think the Department of Work and Pensions is revising the note and thinking about, could other health professionals, not your own GP, be involved in the writing of it, because it would put, I think, a useful space and not make it so difficult for the GP. We had a successful early intervention service out of my report called the Fit for Work service, which was supposed to be testing whether early intervention would make a difference. So people were close to the labour market. You didn't let them drift into being a long way away. And what that showed was you could intervene early and you could get people back to work. What it didn't show was that it was cost effective in the way it was delivered. And then the government had a second attempt a few years after that to do a different sort of early intervention service, but unfortunately they didn't have enough money to do it well, and quite frankly it just wasn't well executed. And so that really is still quite a question mark. We had a very good program for SMEs in which they had a small grant to develop a pilot or something that they thought would make a difference in their company in terms of health and well-being. The whole aim of that program was that once one had got the program going, once the funding ended, they would continue it. And I think that was a very useful program. It gave birth to the Council for Health and Work, which is still a very useful body that brings together any organisation interested in health and work. It also led to Steve Ballman's really seminal review of the health and well-being of the staff of the NHS, which is only in the last really 2 or 3 years we've been able to work on in depth and expand to provide a health and well-being framework for the NHS. And the thing that never quite got off the ground at the time, the government put aside some money for a virtual research centre, because it's an area very deprived of decent research. The government changed, the coalition government came in and they took away the money, so we never got the centre. But 4 years later, the MRC and what was then the ARC put in, I think it was just over $1 million to Southampton University to start a health and well-being research centre for musculoskeletal disease. They're just some examples.
That's great, thank you very much. I guess another thing that has changed since the report was published was the rise of the gig economy and a whole new set of workers that have a different set of rights than people who are in established employment. Do you think that you would have changed the recommendations of the report if the gig economy was a bigger part of economic activity at that time?
Well, I certainly think we would have had to pay it some attention. I mean, if you like, we went down as far as SMEs, but we didn't go, we didn't pay any attention to the gig economy. But I think when Matthew Taylor was given the job of reviewing it and expanding into reviewing what good work was, you could see both the dangers and perhaps some of the advantages of insecure work. It came out that some people liked the idea. They liked being able to organize their hours and to have that type of approach. But for many people, and you can imagine if you had a family or responsibilities perhaps for caring responsibilities and financial responsibilities, this highly insecure work where you had no access to occupational health, HR, sick leave, holidays, etc., was actually made people really quite anxious. and distressed, and it was often the young who were suffering the most. And you can imagine how today these would have been the people who very, very quickly lost their jobs. So it would have been something we would have considered had we had it there to consider.
Thank you. So turning to the present day, one of the points that you make in the report is that when people have been out of work for more than a few weeks or away from the workplace for more than a few weeks, it's actually very difficult sometimes for people to go back into the workplace because routines have been broken. Now, of course, many of us have been away from the workplace for several months now, and we're all going to have to, or many of us will have to start that transition back into our routines and into the organisations where we work. How challenging do you think that is going to be for people, and what can employers, organisations do to support that transition, do you think?
I think, Paul, that for some people this is going to be very challenging. So particularly if you've been furloughed. So you've been furloughed for 3 months. And now you've got the thought of going back, as you say, into a workplace which might look different. Some of your colleagues indeed may have lost their jobs. And I use the word people becoming deconditioned. You've no longer had to get up at a certain time, get ready, get yourself onto public transport or cycle to work, do an 8-hour day. What a lot of people who were on sickness absence told me when we were doing our sort of field work was that they didn't feel they could go back and do an 8-hour day. So this sort of deconditioning from the regular routine of work, and then an associated anxiety about would they be good enough to do their job. Now, I think people's ability to go back in at the present time will have depended, one, on how good has the employer been at keeping in contact with them, what has been on offer for them. So I'll give you a practical example. I'm fortunate enough to chair the British Library, and we have quite a lot of workers who cannot go into the building to do their job, and they can't do it from home. And so we've been trying to offer them further training opportunities, educational opportunities. I think if you've made a real effort to communicate, reassure, and provide something extra, then I think, although we shall experience it and see what happens now, it will be easier to enable those people to come back into work. There'll be the fear factor that will be true for anyone, even if you've been working from your desk, so to speak, in the last 12 months, 12 weeks. That will be the same for you as well as the furloughed worker. But I think it may take a bit of flexibility on the side of the employer. Perhaps people will not be able to come in and do a full week's work to begin with. I think we're going into slightly unknown territory. But I think we should make every effort to enable as many people as possible to stay in the labour market and be in work.
That makes sense. And if, post-pandemic, working patterns do change and we are working a lot more from home than we were hitherto, do you think that occupational health, what organisations, employers do to support the health of the workers, is going to have to look very different when you have these home workers?
I think it's going to be a very unknown world. I think when you've got people now working more from home, what's the division between being well and being sick? Where does that division happen? How would you have any idea about whether people are actually at their desks and working but not working well? So presenteeism, they're not in the office, you haven't got any personal contact with them, you don't have any of those messages which I think managers rely on. If they know their staff well, they would know when someone was not themselves, they looked worried, they weren't able to concentrate. These are all the unknowns, and I think the offer to support people's well-being, so positive mental health, and indeed encouraging them to be physically active, because it's not just your mental health. I think we're going to be edging our way to trying to find out what will work well.
And what about the role of data? I know in the report you talked about the fact that a lot of employers they don't actually know how well or unwell their employees are because they're not collecting data about these basic health outcomes. Do you think that the role of data might have a particularly important role to play as we move into this new way of working?
Yes, I think it would, and it would be wonderful if out of this crisis there was an increased appetite and interest by employers to collect health-related well-being data, because if you can develop a risk assessment of your employees so that you would know, of course, all that would all be anonymous, you would know what percentage of your employees are feeling particularly anxious or depressed. And even more, you would know whether, for example, the young were particularly affected. How many of your employees have got financial worries? Because that has come out of Britain's Healthiest Workplace survey, now in its 7th year, as a very powerful factor and one which leads to a lot of anxiety. Trying to understand where people's risks are and their modifiable risks, where you can help them. And again, if you think about COVID-19, we know obesity is a problem. We know diabetes is a problem. Can the workplace in any way be the catalyst for enabling people to be healthier without being a nanny state? So I think if we can get data, you can then offer interventions that are targeted. And of course, then you can evaluate them. And that means any money or time you're investing in health and well-being isn't lost. Companies want to do the right thing. I've always found that they're interested. They want to do the right thing, but they always say to you, well, what shall I do? What shall I put in? But then if you say, well, what is your employee risk profile? You usually get a blank answer. And so it really would be fantastic if we could get better data collection. And of course, companies are used to collecting all sorts of other data. I mean, they're very good financial data.
Absolutely. Now, you've been working with the Judge Business School for a long time. I'm interested to know what role you think business schools have to play in these sets of issues, in particular the link between health, mental health and work. Do you think that we should be more involved in studying and teaching around these issues?
Well, Paul, I think it would be fair if I said to you, I don't think you have, not you personally or the judge, but business schools been involved. A few years ago, with Professor Carrie Cooper, we did a rather sort of dirty piece of research, really. It wasn't sort of a highly constructive piece of research. We took over 150 business schools in the UK, and we asked them, was there anywhere in their curricula that they had anything that talked about health and well-being as a driver of productivity? Did they do any teaching in this area? And the simple answer was we couldn't get one business school that told us they paid any attention to this. So I would really like to see that happen. Ill health and the consequences of ill health in causing absenteeism and presenteeism is a contributor to lost productivity. And we know that productivity has been going down in the UK, I think, for the last 6 years. And if you look at Britain's Healthiest Workplace survey, you can see the number of days lost each year in their annual survey, lost productive days due to health-related absence and presenteeism. So I think you can start to build up that connection between health and work and well-being. And it would be wonderful if the business schools didn't think this was soft and fluffy and saw it as a useful addition. Harvard Business School, I think it must be perhaps 5 years ago, started a program with the Harvard School of Public Health. And they do have a training program that brings public health business school together. And I have been over and talked to Gloria Sorensen, who is the public health lead for that program. So there are green shoots now around the world, but I think it would be excellent if a little bit more thought could be given to this topic by business schools.
Well, I would certainly wholeheartedly endorse that, and particularly the idea of partnership between business schools, medical schools, and other social sciences, perhaps, as a way of pushing that forward. Maybe if I can just ask you, by way of conclusion, if you've got any other final thoughts or advice that you would like to add to what you've already said to our audience around the world.
I think we've covered most things. I do think that we now have a unique opportunity with COVID to really recenter on this issue. It upsets me, for example, that when the virus hit the United Kingdom, we weren't a healthy nation. We have too much diabetes, lots of people with hypertension and having heart disease. These are modifiable factors. We've always assumed that somehow people will manage these things as if by magic, or they will be managed in the community, perhaps by at a general practice level, but general practitioners are so extremely busy. And if you took those more physical factors and then the mental health needs that people have, I would like to think about public health in the workplace. Can we enable people as they go through their working lives to stay as healthy as possible, to be able to contribute as much as possible, and to go on contributing that, beyond what might be considered their normal retirement age, and enjoy it and being good enough health to do so. So I sort of hope out of a rather awful crisis, perhaps we can recenter our thoughts on what we could all do to enable that to happen.
Thank you, Dame Carol, for joining us and for sharing your fascinating perspective and your deep knowledge on the important issues around health and mental health at work. It's been so interesting to talk with you, and we greatly appreciate you participating in CJBS Perspectives, Leadership in Unprecedented Times with the Cambridge Judge Business School. And for all of you who are watching this interview, I hope you have found the conversation interesting and relevant as we try to return to some semblance of normality. A big thank you to all of our alumni and to other members of the CJBS community who have joined us today. Thank you very much.